Dr. Roger Seheult, with the work that you do, what is it that you're aiming to accomplish?
Outside of my clinical duties, and maybe even part of that, I would like to clearly explain very easily graspable tools that can be implemented to make people live their best life. And it's specifically in terms of their health and their well-being.
And as we dig down into health and well-being, because that's quite a broad basket, what is it within health and well-being that you've spent your career, your life focusing on?
So I'm a board-certified internal medicine specialist. Then I did an extra 3 years of training here in the United States on pulmonary and critical care. So I deal with all of the issues that are related to the lungs and the critical care aspect. So if you are admitted to hospital and you're critically ill, you go to the intensive care unit, I'm the doctor that you see. So I'm putting in the lines, putting them on vasopressors, intubating them. I worked in the clinic this morning.
And what are some of the unappreciated things that most people don't think of? Because we think of, don't eat processed food and exercise. But is there things outside of that that you don't think the average person appreciates enough?
Yes, absolutely.
What are those things?
So if we look at those things that extend life and are beneficial, we could put them into what I call 8 pillars of health. If you can imagine your life is a chain with a bunch of links, okay? And I'm talking medically. Each one of those links is an organ system. So your heart is a link, your lungs are a link, your liver is a link, your kidneys, et cetera, et cetera. As you go through life, imagine those links starting to erode so that at some point in your life, you're going to get some sort of a disease or a diagnosis that focuses on one organ system of your life. For many here in the United States and in the UK, it's the heart. And as that link gets more eroded, we can see very clearly that this is going to be the link that's going to break first. And therefore, attention is paid to that link. For many, that diagnosis comes with medications. So here is one of the first truisms that I would say going forward. All medications have side effects. And what the aim is to do in modern medicine is to utilize the knowledge of those medicines and their effect on the human body so that we leverage the other links to protect that weakest link. So I could go through a bunch of medications that I give all the time to patients in the intensive care unit where I'm focused on saving their life because I can clearly see which link is the weakest. But I'm doing it knowing that there's side effects because I'm trying to save that link, to save that life. And I'm leveraging those other things. For instance, somebody comes in with a stroke and they've lost weakness on the right side of their body or on the left side, whichever side. I can give them a medication immediately that will break up all of the clots in their body. It's called TPA or TNK. And it will restore blood flow to the brain, and it will reverse many of their symptoms. If they come in soon enough, we can do this. What's amazing is that medication has an effect that can do that, but it also has a pretty significant side effect in that it could break up clots somewhere else and cause bleeding. So we have to be careful about what it is that we're doing. Clearly there, what we're doing is we're saving one link at the expense of other links, but that's what you have to do in an emergency situation. But if after that, I simply send that patient home without telling them why they had that stroke and what they need to do to prevent themselves from getting that stroke again, and what are the lifestyle factors that cause that to happen, I haven't done my job. So what are the interventions that we can do, hopefully early on in life, so that we don't have those links eroding, so that all of the links are strong. And as we get older, we can continue to strengthen all of the links. Here are the 8. So nutrition, that's nutrition. Basically, we know there are studies that have done that show that depending on what we put into our bodies as food can have a dramatic impact in terms of our well-being, okay? So that's nutrition. Exercise. As I was saying, exercise drugs and things have side effects. Exercise have side benefits. So exercise obviously is going to make you more fit. It's going to make you have better endurance. But did you know that it reduces stroke? Did you know that it improves well-being? It reduces depression. There's so many benefits. So all of these links are actually improving. There's no leveraging here. Exercise is incredible. Water. So this may sound obvious, right? Like you drink because you're thirsty. Where I would like to go today is to talk a little bit about what the effect of water externally on your body can do.
And you're talking there about like hot and cold
Exactly.
usage.
Exactly.
In terms of showers or cold plunges, saunas, that kind of thing?
Exactly.
Okay.
And we'll get into the actual evidence for this.
We'll get into it later, but what is
this affects your immune system?
Which changes your probability of diseases and
Correct.
stuff like that?
Absolutely. Especially in the acute setting. Especially. Okay. So not only in the acute setting, but we also have pretty good data from Finland where they have more saunas than people, where they've actually done the research and shown with dose response curves that this is actually very beneficial. We won't get into too much of that, but what I want to focus a little bit more on because of my job in the intensive care unit and what we're seeing right now with viruses and mutations in the innate immune system, why something like this may actually be very important as we look forward. Interestingly, as we look forward to future things, pandemics, we can look backward and see what we had done in the past. And we've got some really good information on that. Let's go to sunlight. This is something that I've really become more and more involved with because of some of the benefits that this can do. A very big misconception that people have is that sunlight equals vitamin D. And therefore, if you take a vitamin D supplement, you don't need to go in the sun. This is really something that's now being debunked. Sunlight has far more benefits than just vitamin D. Not saying that vitamin D is not something that you want to supplement with. I supplement with vitamin D. I think there's a benefit to supplementing with vitamin D, no question. But sunlight has so many important things, and I really would like to spend the bulk or the lion's share of the time talking about this because this is really important. Mm-hmm. This is amazing, and it really made me think about sunlight. So this is a story by a lady by the name of Amy Hohnmeyer. Her 15-year-old boy was diagnosed with lymphoblastic leukemia, went into the hospital, actually started chemotherapy for it.
Which is blood cancer?
It's a blood cancer, yeah. And so the treatment for blood cancer is chemotherapy, which he started. The side effect of chemotherapy is suppressing the immune system. And unfortunately, he didn't realize it, but he didn't realize it immediately, but he developed a fungus flesh-eating infection in his lung and went into the hospital in June of 2024. This is in Minnesota, tertiary care hospital. And he got worse and got worse and got worse to the point where the only way that they could control this infection was to actually remove his left lung, which they did. So this is a 15-year-old boy. He is without his left lung. He only has a right lung. And he starts to decline even after that. They do a CT scan, and it shows that now the infection has moved to his remaining right lung. They have a family conference. And as Amy is telling me this story, I could hear her choking up. She's telling me this on the phone. She's saying that he's 15, he's completely awake, he's completely alert, he knows everything that's going on around him. He's on a ventilator, like a machine that they use for sleep apnea. It's like a BiPAP machine that's breathing for him. It's not intubation, but it's on his mouth. And the doctors, have done everything they possibly can, and they say, look, he's getting worse. We can't take the right lung out. We can't put him on a heart-lung machine because there's no sort of destination to where he's going. We recommend not intubating him and making him what they call DNR, do not resuscitate. So they're like, wow, they were not expecting this coming. So they have a big conference. They call in help to how do you explain to a 15-year-old boy that you're dying? And how is that going to feel? So they ask the doctors, how much time does he have? They say 2 days. So in this situation, they ask this boy, okay, you're going to die. What do you want to do with your life in the next 2 days? What do you want to do? And surprisingly, he says, I want to go outside. I just want to go outside. This guy grew up probably on a farm or something, and he spent his time outside. So he wants to go outside. So you know how, I don't know if you know this, but if you're a nurse or you're a doctor and you've done everything you can and you're just completely horrified at the fact that this 15-year-old is going to die, and he has one request, you're going to move heaven and earth to fulfill that one request. And that's exactly what they do. They Get this boy, the hospital bed outside. He's on a BiPAP machine the respiratory therapists have put together. So this guy is outside. And they're not putting him outside to get better. This is his dying wish. They also use this thing called a Firefly. It's like a light device that they were using. I'll be honest, I don't know which did it.
The Firefly, what's that?
It's a light device that gives off light at different wavelengths. And they would use that for about 3 times a day for 5 minutes. This guy does not die. After the first day, his white count starts to come down. That's like a measure of the infection that's going on in the lung. And by the way, they do a CT scan of his lung before this all starts, and it's just the remaining lung on the right is just filled with infection. It's horrible. By the second day, the white count comes down even more. And by the way, they haven't changed any of the other treatment. By this point, he's been in for 6 weeks. He has not seen the light of day, and he's still getting the powerful antifungal medication, amphotericin B and posaconazole. All of these things are really high-powered drugs that just completely fight fungus, but it's not working. He's getting worse. But now he's out for the second day. The white count's coming down, which is good. It's a good sign. His oxygen requirement is coming down. That's a good sign. He's requiring less and less oxygen. By the time he gets to day 5, okay, we're already past 2 days. He's off the BiPAP. He's on regular, just nasal cannula oxygen that you see people wearing on their nose. The doctors are scratching their head. They're like, we should get a CT scan to see what's going on. So Amy tells me that they get a CT scan of this guy, and they're in the room, and some even like swear under their breath, like they're completely amazed. Because on the CT scan, obviously the left lung is still gone, but the right lung, the disease is probably 60, 70% gone. And he's still alive. He goes home. There's no sign of the disease after treatment. And she just communicated with me to tell me that he just got his Make-A-Wish thing for his cancer. He's continuing treatment. And she just can't believe that he was literally 2 days away from dying. They changed nothing. They changed none of his treatments. The only thing that they did was they took him outside, and they were using this Firefly before inside, but they were using it more consistently when he got outside.
Maybe hospitals should be outside.
This is exactly what, okay, so if you wanted to know what my drive was, what it is, my purpose that I'm doing right now, I'm working at 3 different hospitals. And I'm trying to work in each of those 3 different hospitals to try to get patients outside. The biggest barrier that we have is staff taking those patients outside. That's the thing that's the hardest. But this is what we used to do, Stephen. This is what we used to. When we built hospitals at the turn of the century, we had hospital rooms where beds could be taken out onto the veranda and people could get sunlight. I would love to see a time where we could go back to that type of effect. There are studies that have been done. People in a 2-bed room, if you're the bed closer to the window, you get discharged from the hospital faster, on average.
Really?
Yes.
I need to swap sides of the bed with my girlfriend. She's on the sunny side.
There's so much evidence for this. People who are in hospitals that have bigger windows, they give better surveys. And hospitals' reimbursement is tied to the surveys that they get from patients. So it's literally a win-win-win. If hospitals started to, I believe, get patients outside, and they're already doing this. I don't want to say that this isn't happening. There are hospitals that have programs to get patients outside. I think we just ought to be doing it a lot more. Temperance.
Temperance? What does that mean?
It's an old term, isn't it? It really means moderation. And I would say in this sense, temperance really means to avoid toxins in the body. As somebody who is a pulmonologist,
What's a pulmonologist?
A pulmonologist is someone who takes care of the lungs. And so as a result of that, I see a lot of issues with lung cancer related to smoking. I see in the intensive care unit people with liver failure as a result of alcohol abuse. I also see people on amphetamines here in Southern California where I reside and where I work. We have quite a bit of that. and temperance. If you want to live a long and wholesome life, there are some toxins that you want to avoid, and understanding that is really important. So this is something that if you stop some of those things that we're talking about, all of those links are going to be improved. Air. Seems kind of obvious. Early on, I used to think that what this meant was getting pure air with absolutely nothing in it except for just nitrogen and oxygen. That's not true anymore. We now understand that for you to have the best type of air, it actually has to come with some things in it. Just like our gut has a microflora that you may have heard about, so too does the air that we breathe also must have that. And the best type of air that you can have is actually outside. Rest. This is really interesting because we just mentioned that exercise was a pillar, but rest also is. How can rest and exercise at the same time be pillars of health? And it really comes down to knowing when to do what. Sleep, which is also part of rest. So we're not just talking about a daily rest when you go to sleep. And as a sleep physician, I can tell you quite a bit. We have lots of information about how long we should sleep, the quality of sleep, some of the diseases that prevent us from sleeping. Sleep is so important. I couldn't overexpress it enough. Not just a daily rest, but I would also say, and venture out, we can talk more about this, a weekly rest.
A weekly rest?
A weekly rest.
What do you mean, a weekend?
Yeah, absolutely. How many times do we, even on the weekend, do we put down our phone?
Never.
Or we stop reading emails. And we take the time out to do things that we would never be able to do. Finally, trust. So this is something that really just can't be ignored. And I'll say this up front, that in the world of research and science, there is a silo of science and there is a silo of faith. But what we can't ignore is the growing body of evidence from the scientific world that's peeking over and looking at faith, that people who have faith and people who have faith